Los Angeles County has over almost 3 million people uninsured. And all too often, the only interaction with the healthcare provider they have is with our School of Pharmacy.
The USC School of Pharmacy is dedicated to improving healthcare for those in the community. One of the ways they meet this goal is with faculty and student involvement at a Skid Row clinic.
We are at the Center for Community Health, which is one of the few comprehensive medical homes that are just provide everything for any patient that comes in.
There's the pressure for doctors, especially primary care doctors, to see a certain number of patients per hour. And if a patient comes in with multiple chronic disease or they're on multiple medications, what we call polypharmacy, it's hard to spend 20 minutes and get every single thing that the patient needs to know. And what the pharmacist can do is actually take the ones that need education, need adjustments made in their medication.
So we get diabetes patients, hypertension patients, cholesterol patients, asthma, all these different chronic conditions where patients just are not reaching goal and they're using up a lot of valuable healthcare system dollars. They're going to the ER a lot, they're going to the emergency, the hospital, and they're seeing the physician a lot and taking up a lot of the physician's time when the real root of the problem is they're not receiving or using drug therapies optimally.
I went into a diabetic coma, almost died. Dr. Chen, I give him the credit for help saving my life. Because from him, I know how to count my carbs, I know my Liptoids, all that. I know about eating well-balanced meals.
Chen's method was extraordinary because he would have me come in on a regular basis, and he had 2 assistants always working with him that were incredibly diligent. They made me test my blood 5 times a day to find out if my levels were this, going up, down, even the most minor adjustments that were needed.
It doesn't matter if the patient is homeless or not. I'm helping my community and I love it. When I see the difference after I help them, I see the improvements, I love it.
USC School of Pharmacy students reach deep into the community by treating patients in 80 languages, involvement in 60 health fairs, 12 low-income area clinics, and by volunteering in student-founded and student-run clinics like the Pharm SC Clinic in East Los Angeles.
A patient that I work with at the clinic, we were going through all of the different values that we could screen for, and we noticed that her blood glucose was just sky high. It was scarily high. And because of that, we referred her to a free clinic where she could get diabetes strips and medication that would help control her sugar levels. And I think that was an important moment for me and us at the clinic to see what an impact that we could make even on just one individual.
It's key, especially in a community like this one where people aren't really sure of what diabetes is or what having high blood pressure means. And so for us to be here and be able to provide not just the screening but education as well, I think is valuable to this community.
As health professionals, the school is also committed to providing materials that engage and impact behavior.
In the Latino community, telenovelas, which are essentially soap operas, are very popular. So we take that same format and we put it in a comic book format. So it's a format that people are familiar with, so they read it.
And as a result, thousands have been helped by them.
We believe that these kind of programs are, again, important. They're part of our DNA. They're things that we've been doing for years and years and years, and we will continue to do them.